Namaskara, welcome to my channel. A hearty welcome to all of you. We are meeting after a long time. In our last episode, we had spoken about the diet for PCOS, thyroid and women above 40. We all know that diet is not the only thing. Though 80% of the weight loss and maintenance can be done with diet, we need to exercise also. Why do you think we need to exercise? It is basically because to keep our bones strong and also to keep our muscle mass index so that even if there is a fall or even if there is some kind of injury, the bones do not get affected. We all know after 40, the bone starts becoming brittle and weak and we need to supplement it with calcium. But not always calcium is sufficient. We need to exercise and keep the bone strong and also keep the muscle mass. So today let's understand what exactly we can do. What are the exercises a patient of PCOS should do, a patient with thyroid deficiency or hypothyroidism should do, and a patient above 40 or a woman above 40 can do the exercises. We all know that for PCOS we need to do cardio exercises, and for thyroid, because of low metabolism, we can do cardio and also a mixture of weights and yoga. And above 40, the general thinking is above 40 we can only do walking and no other exercises can be done. And if I ask patients to hit the gym, they say we are above 40, can we do it? No, all of us can do exercise above 40 and we can also visit the gym or hit the gym and then do weights, do different kinds of cardio exercises, do weight training. Everything can be done after 40 years. Of course, the caution is your trainer should be there. Now let's ask Dr. Brinda, who is a fitness freak, about what exactly women above 40 can do, our PCOS patients can do, and our patients with thyroid problems can plunge into different exercises. Over to Brinda. Hi Dr. Brinda, welcome. After that very popular video which we shot, everybody was so excited to go through the video. Let's also give tips on exercises because this is going to make a lot of difference to our women feeling fit, getting into different clothes and also looking beautiful. I think these are some important tips our women want. So you tell me, how can a lady with PCOS become more fit with exercises?
Yes, ma'am. Thank you, ma'am. A PCOS woman can go for 60 to 90 minutes of workout session per day, including mainly high intensity interval training, ma'am, and cardio. About 5 to 6 days a week and 6 to 8 months, ma'am.
So you say 1 to 2 hours?
Yes, ma'am.
Yeah. 1 to 2 hours, 5 to 6 days a week. They have to go in for cardio and they have to also do high intensity exercises.
Yes.
You mean when I say high intensity exercises, it is burpees, jumping jacks and then your squats, everything. Okay, good. That is something which a young PCOS patient can do. Now women above 40, what all they can do? Their bones will ache a little, knee pain will be there, but can they do high intensity exercises?
Definitely, ma'am. There is a PCOS rule in the workout, ma'am. 12-3-30 rule we call. I mean to say that the definition is 12% inclination on a treadmill at 3 miles per hour. I mean to say 5 kilometers per hour speed,
okay,
and for 30 minutes.
Hi. So welcome back. Now what I was telling is the different kinds of exercises. Let's ask Dr. Brinda, who all can do the different kinds of exercises? Like a PCOS patient, hypothyroid and women above 40. What are the different exercises each person can do to remain fit, to look beautiful and to get into your favorite clothes? Over to Brinda. Let's
Thank you, ma'am.
dive deep into it.
Thank you, ma'am. It's 60 to 90 minutes of workout, ma'am, for PCOS ladies. 5 to 6 days a week and for 6 to 8 months, ma'am. It mainly includes high intensity interval training, ma'am, and cardio.
Okay, you mean to say 5 to 6 days a week, about 1 to 2 hours?
Yes, ma'am.
Every day, and then high intensity. When I say high intensity exercises, it is jumping jacks, it is burpees, squats, skipping and jogging, swimming, and
Yes,
then
ma'am.
cycling.
Yes.
All these are high intensity exercises which requires a little more energy and strength for a person to get into it. That is, you start doing it slowly and then you increase your intensity. What about hypothyroid patients?
They can go for cardio workouts, ma'am. It's basically metabolic related syndrome. So they can go for cardio, cycling, brisk walking, even swimming will do, ma'am.
Okay, so for hypothyroid patients also, because their metabolism is low, they should avoid carbs. That is, they should be low carb intake and high protein intake. So if you can take some protein shakes or eggs or high protein diet, vegetarians go in for protein shakes and all the vegetables or all the grains which has high protein. And then of course non-vegetarians, it is very easy to have protein diet and also protein supplements, and then the exercises which increase your heart rate, that is cardio exercises like jogging, high brisk walks, swimming, cycling and burpees, all those which burn your calories faster. So that would be ideal for hypothyroid patients.
Yes, ma'am.
Now women above 40. A woman is hypothyroid and she is also above 40. What do you advise for her?
They can go for brisk walk, ma'am,
Yes.
and jumping jacks and burpees, of course, and lunges, and they can go for squats also, ma'am.
Yeah.
Yeah.
Okay. So all high intensity exercises
Yes,
they can do. They can do weights also.
Yes, ma'am.
Yeah.
Yes,
They can go up to any time,
Yeah.
any amount of weight, but that should be under a
Trainer.
trainer. So under a supervision of a trainer. Women above 40 also, please consult your doctor first whether you can do those exercises. Once you're okay, and then you can go and hit the gym and do weights. You can do cardio exercises. You can also do lunges and burpees and then jumping jacks and then squats. All these can be done as long as your knee permits. In case you have knee aches, get your checkup with an orthopedic surgeon and get a clean sheet that you can do those exercises, and you can hit the gym and you can start lifting weights also. Lifting weights will give you a good muscle mass, and a good muscle mass above 40 and a toned body will keep your bones also strong and muscle also strong. So let's see which are the exercises we can do. We'll give you a live demo of the different exercises which we'll be doing in a few minutes.
Namaste everyone. In today's session, let's know about asanas in PCOS. Let's do one by one. First one is Setu Bandhasana, that is bridge pose. Lie down on your back. Try to lift your back. And be in this posture for 1 minute with normal breathing. You can do 1 minute for 3 repetitions also. Relax. And the next one is Bhujangasana, that is serpent pose. Lie down on your tummy. Try to lift your shoulder. Be in this posture for 1 minute. Do normal breathing. Try to look up. Spread your legs. Try to hold your ankles and lift. This is Dhanurasana. Bow pose. Try to be in this posture for 1 minute with normal breathing. Come back and relax. Next one is Marjarasana and Midilasana. That is cat pose and cow pose. Let's do it. Come front. Try to lift your back. Come down. Lift, down, lift, down, lift, down, lift, down. You can do for 30 repetitions and for 3 cycles. And the last one is Chakri Chalanasana. That is bounding rock pose. Come back to sitting posture with legs straight. Spread your legs apart. Try to touch your toes with your hands in a rotation movement like this. Bend forward. Do it for 1 minute and 3 cycles. All these asanas stimulate pelvic organs and reduce